Okay, so hi for people who are joining our series for the first time. I'm Cheyenne Martin, and I'm the manager for the South Texas CHW Workforce Preparedness Collaborative. We're HRSA funded, and we have several training and academic partners who are providing continuing education for CHWs. And then the series that you're joining is our fourth in the series, and it's on evaluating public health interventions. And so we kind of opened up this series with program management and leadership and data, and that really leads us into today on evaluation. Because if you collect all that data, you need to use it. I'm gonna go a little bit quicker so that we can get through the most of it in an hour. And so I'll use the chat box for a lot of interaction, but there will be some time that you can come off mute. So go ahead and put in the chat box, what comes to mind when you hear the word evaluation? Either feelings that you feel or the content area. Has anyone done evaluation? All right, I gotta go find my chat box. There we go. All right, research, assessment, measure, review, data, getting a feel of something. I like that. Yes, like, yeah, effectiveness, growth. I love it. Success stories, assessment, sustainability, questionnaires, making sure we're meeting the needs of individuals, getting opinions, telling our stories, measuring performance, research and innovation. I love it. It's still coming in. Thank you. Okay, and what do we evaluate in public health? Services, health outcomes, whether there's improvement in the projects that we're leading, the success of our programs, how well we're communicating, health trends, changes in behaviors, community services, surveillance, that's a good one. How are disease and health trends, or what are the health and disease trends in a population? The program implementation and evaluation of health outcomes and how to better make it effective for the desired population. Love it. Thank you. Sorry. Okay, so I like dividing up how we evaluate in public health. You start with like our public health intervention or program, and then you look at the kind of the different sections of what we want to evaluate in public health. So are we trying to prevent a disease or promote a particular behavior or change, or improve health in general? Are we doing an educational program? Who are we targeting? So we want to evaluate if we're reaching our intended audience and if it was appropriate for that audience. The level of intervention, is it at the household level, the community level, organization or policy level? And then what's the intended change? So I'll go back under educational. Are we delivering a course? Do we want to evaluate the quality of the curriculum, the teaching methods? We all learn in different ways. As CHWs, and especially if there's any CHW instructors on, we'll go over, what are some things that you can do to evaluate the classes that you're providing. Target audience, is it for community professionals, healthcare professionals, the lay or public audience? I already mentioned the level of intervention. And then intended change. Are we trying to change the environmental factors? Are we trying to teach something technical, or are we trying to change policies? Okay, so that's the what. But what about the why? So this slide sets the stage for why this module is important for public health community health workers. Um, Public health programs are designed to improve and protect the health of populations. So, for example, a vaccination program promotes vaccine uptake so that we can prevent the spread of infectious diseases like COVID-19 and measles. And then the parts of a program evaluation, they inform decision making. So we want to continue programs that work and discontinue programs that have no change or cause harm. We want to assess effectiveness. So whether a program can be determined to be successful depends on measuring its impact. We want to identify best practices and support continuous improvement. So determining why or why not a program succeeds or figuring out what to change about the program, we can create greater success in the future. But we have to know what it is about a program that is making it effective, and what about a program should we change to make it better. Evaluation also improves accountability. So measurement keeps programs accountable to funders, policymakers, and importantly, communities. And then this is a quote. There's a lot of different iterations around it, but you can't improve what you don't measure. So measurement is very important. In our last module on data, you all learned about some ways to do the actual measurements. Okay, so today by the end, I'm hoping that you will be able to understand the difference between public health evaluation and public health research, know some common types of evaluation and what could be useful in your line of work, um, have some concrete steps you can walk away with for developing your own evaluation plan, and then thinking about your role as CHWs in evaluation. Seeing both your value and how you make evaluation stronger. Okay, so evaluation versus research. I can't say any better than this quote. Research seeks to prove, evaluation seeks to improve. So the purpose of evaluation is to determine the effectiveness of a specific program or model and understand why a program may or may not be working. And the goal is to improve programs, whereas for research, the purpose is theory testing and to produce generalizable knowledge. The goal is to contribute to the knowledge base. And so a public health researcher might design a program based on a theory, such as a behavior change theory, and saying, if I teach someone about the importance of vaccines, then they'll go get a vaccine. Whereas evaluation is gonna evaluate whether or not there was uptake and that education program was effective. So we're gonna go over a few breakdowns between evaluation and research. And so I invite you to and thank you so much for people on the chat who are elaborating on the differences between evaluation and research. Definitely pay attention to the chat. I'm running solo today, so I'm not able to monitor throughout, but thanks for everyone who's contributing. Okay, so this purpose, to generate new knowledge and understanding of health-related factors, including causes of disease, health behaviors, and interventions. Does someone want to shout out if you think this is research or evaluation? You know what? I realized I might not be able to hear anyone because I am on a different computer.
Research.
Oh, thank you. Okay, I can hear. Awesome. Okay, yeah, you're right. The answer is research. So the primary purposes of evaluation is to so this is the purpose of research. The purpose of evaluation is to determine the effectiveness of a given intervention or assess and improve the quality of the intervention. I think by the end of the hour, you're gonna be so sick of me saying quality and effectiveness. All right, next, focus. the implementation process, program activities, and short-term and long-term outcomes to determine program performance, effectiveness, and impact. Probably just gave this away, but is this evaluation or research? Seeing a lot of eval in the chat box. Yes, y'all are correct. All right, methods. Quantitative and qualitative research methods, which include surveys, interviews, focus groups, observational studies. I see some research. Both. Yes. Aha, both. You are correct. This was a trick question. So there are some slight differences, but both of these methods are used in research and evaluation. And finally, audience. Program managers, policymakers with an asterisk, and funders. Oh, I like it depends. Anyone else want to put themselves out there? It depends. Anyone else? Research, eval, both. Okay, so kind of another trick question. So this said, like program managers, funders, that audience is for evaluation, but policymakers is both. So research also targets policymakers. So I'll send out these slides, but you'll have this in writing for reference. Okay, in the very first session, you saw this wheel. It's the 10 essential public health services framework. And then come off mute for this or use the chat box. So based on the distinctions we just made between evaluation and research, can you pick out any of these essential services that are related to public health research, public health evaluation, or both? I want to share. Enable equitable access. Yes, so we want to research drivers of equitable access, but then we also want to evaluate the reach of programs and health outcomes to know whether or not equitable access is being achieved. All of it. I like that, Lisette. Well, you can see in this top section, assessment, assess and monitor population health. That's very clearly evaluation. Investigate, diagnose, and address health hazards and root causes. That's more research. Improve and innovate through evaluation, research, and quality improvement. So that's where we're going to see an overlap. Okay. So before we move on from research, I just want to mention community-based participatory research. Put up a reaction, a heart, a thumbs up if you are familiar with CBPR. See 2 thumbs up, 2 hearts, 4th. Okay, yeah. So there's a few of you. Like, that's your favorite research style. I love it because CHWs are so central to CBPR. So this is the definition. CBPR is a collaborative research approach that is designed to ensure and establish structures for participation by communities affected by the issue being studied, representatives of organizations who are working with those populations, and researchers in all aspects of the research process to improve health and well-being through taking action, including social change. So it's a newer type of research, but very popular in public health and especially like researchers who are working with communities, which is close to a lot of people's hearts. So it rests on two main pillars. The first is ethics and responds to a history of exploitation of communities, especially minority and low-income communities, in the name of research. The second pillar is community empowerment. It promotes co-learning and assures the community has control over all phases of the research process. And so CHWs play a big role in CBPR. They enable the community to gain some control over the intervention and its delivery. And the same is helpful for evaluations. CHWs play an important role in ensuring the community has control over their representation in the data, their story is not told incorrectly, and that the evaluation results are shared with them at the end and utilized in a way that benefits them. So when data is collected, we want to make sure the data is analyzed, and then from that analysis, there should be action, and that action should support the community. So we'll return to these concepts at the end after we learn a little bit more about designing public health evaluations. All right, getting to the meat of it. Evaluation types. So your evaluation strategy should depend on the timing of the program. Is it in its infancy? Is it a more mature program? Is it just an idea in your head? And then your type of evaluation that you want to do should be included in your project proposal or plan as your evaluation plan. You want to identify or what you choose will largely depend on the timing and the level of the intervention you're evaluating. I can start as early as during the development intervention to gather feedback, or not until the end to measure impact. I don't recommend only ever doing an impact evaluation, but that's the ultimate evaluation. A gold standard in evaluation is to assess the delivery of an intervention from beginning to end, as in a process evaluation, which we'll go over. And the type of evaluation depends on what the program seeks to learn or demonstrate the intervention. So each of these frameworks will give you different kinds of information. So for example, a formative evaluation is done in the early stages of an initiative to pilot test for the purposes of obtaining feedback, adjusting and enhancing the intervention components and content, and guiding the future directions of the initiative. So this is really good when your organization has an idea and they want to collect some data, such as through a needs assessment, or they do a focus group to see how this intervention would be received by the community. And would it even meet the need that's been addressed? And the next is a process evaluation. This focuses on the intervention itself as opposed to the outcomes, and it should occur throughout the life of the program. And then I have here training evaluation, because I think it's really important for CHWs, especially CHW instructors, to be aware of training evaluations. And this is going to evaluate whether or not the learning objectives are being met. And then finally, there's an impact evaluation, which is done at the end, and it encompasses the overall merit of the intervention in terms of immediate impact, as well as intermediate and long-term outcomes. And so now we're just going to dive in a little bit. Just doing a time check. Okay, just going to dive in to each of these, and you can see what might be most appropriate for your program. So the formative evaluation, you're going to be obtaining feedback and then adjusting or enhance. Yes, we'll send the slides out. Send the slides in the recording. So you're going to get that feedback, and then you're going to adjust your plan for the intervention, and this is going to guide your future implementation. And so it's this top part. You're identifying the community need, and you're designing let's note someone else. But the part circled in blue, you're identifying the community need and you're designing the program. Then, so an example of a formative assessment is a needs assessment. Show of hands, who's been involved in a needs assessment or used the results from a needs assessment? In public health, a community needs assessment is a systematic process that helps, okay, lots of hands, hearts, love it. So in public health, a needs assessment is a systematic process that helps community leaders identify issues and areas for improvement within their community. Love it, Alexandra. You can't just go into a community and say, I have this solution, I have this program, if you don't understand what the needs are of the community. And that's both the epidemiological needs, like what is the disease profile of that community, but then also what does the community want? They can't go see a doctor to get a vaccine if they can't feed their family at night. So it's really important to involve the community in this step. Next is the process evaluation. As I said, it focuses on the intervention itself. And it enables an understanding of the program's context and is integrated with routine program operations. So all program stakeholders, not just evaluation experts, are involved in contributing data to a process evaluation. Program evals are a driving force for planning effective public health strategies, improving existing programs, and demonstrating the results of resource investments. So here you can see this is the CDC cycle for a process evaluation. Involves engaging stakeholders, describing the program, gathering evidence, justifying the conclusions, and then importantly ensuring that the lessons are shared. A gold standard is a logic model. If you attended the data webinar, then you were introduced to a logic model. Get used to it. It's very important. It's a roadmap that helps link your resources, so like people, money, time, space, facilities, into producing activities. And those activities should produce an output. So if you develop I'll wait for an example. And then the output is what leads to the outcomes and the intended impact. Let's look at an example on the next slide. So here is a logic model for child abuse and neglect prevention program. Your inputs are staff, money, and partners. And that all goes together into designing a patient education curriculum that includes 6 interactive modules. And it's delivered to parents. So the first activity is the development of the curriculum, and the second activity is the delivery of the curriculum. And then your output would be measured as 6 modules developed, 20 parents attended training. And so if those 6 modules were developed and 20 parents attended the training, then we expect that parents will have an increase in knowledge of child development. They will have learned new ways to discipline. And that new knowledge will lead to improved parenting skills as our medium-term outcome, which will ultimately reduce rates of child abuse and neglect among participants. All right, next. Actually, before I move on, just because logic models are so important, any questions there, or anyone have an example of when you used a logic model?
I just came off of mute. I know it's a bazillion people here, but
Yeah,
I used to
hi,
work at
Angela. Good to see you, hear
nice
you.
seeing you too. I worked at United Way and we had this booklet that was called Measuring Program Outcomes. And all of the partner agencies use the exact same logic model. And then over time, it was put into an actual electronic format. And so every single partner throughout the entire county was using this exact same logic model. And it was unique to see the difference between inputs, outputs, and outcomes versus results. And so I hated the language initially because it seemed so confusing. How come an outcome is an output? And so just having the definitions has helped me over time. And I love evaluation, even though I don't do it. I just love it. And I love people that do.
No, I think when you get these slides, print this and put it at your desk, wherever you're working, if you're designing programs. And I like that you picked up on like, if several organizations are doing the same program, whether or not they're working together, there's going to be quantifiable data in when you actually, so there's like the planning your logic model, and then there's the filling it in of what actually happened. And so you can compare, how many activities happened at site A, B, and C, how many people participated at A, B, and C, what was the % increase in behavior or knowledge at A, B, and C, and then collectively, what was that impact at the community level? So it's such as like a simple I'm sorry, I'm not offending anyone. I think it's like once you understand the difference between these 5 categories, then it's just like this like simple roadmap that anyone could do. You can Google online for examples of logic models, and they're all over. Yes, slides. Yeah, thanks, Betsy. All right, thanks, Angela. So moving on, training evaluations are another evaluation that I do a lot. I mean, I am leading a CHW training, so I evaluate my trainings. I ask for you all to evaluate them. So it's a systematic process to analyze the effectiveness of a training program and determine if the learning objectives were met. The results include both the learning and the behaviors of the learners, but also feedback, your satisfaction, your reaction to me as a facilitator, to the content being taught. Is the content appropriate? Was I using language appropriate for this audience? So all really important to do if you are doing any kind of instruction. So the Kirkpatrick model, another age-old model. You may or may not have heard about it. I'm a little curious if anyone in the chat, if you want to give me a thumbs up if you've heard about it. I would say among training evaluations, it's one of the more popular ones, and you may have done it without realizing it. So level 1 is, did the learners like it? That's their reaction. Level 2, did they learn it? The information that you were teaching. Level 3, did they use it? Did the learning change their behavior? And so this you're going to need to measure a little bit in the future, where you can ask about what they intend to do. And then finally, level 4, did it improve results? So did they learn behaviors that went and made an impact in their community? So here's an example. This is a program that CHWs were trained on a curriculum. And so at level 1, there was a satisfaction survey with the CHWs. The findings were there was high satisfaction with the certificate program, the learning approach, the delivery method by the instructors, and the content. And then at level 2, the CHW's knowledge was assessed. Did they learn? Their knowledge was assessed through individual interviews, both before the training and then immediately after, and then 1 year later. So it's really helpful to be able to assess. We hear the term pre-post test. So you take a knowledge test before, take a knowledge test after, to see if there was a change in knowledge, and then a time out, 6 months out, a year out, to see if they were able to retain that knowledge. In this case, the evaluation showed that there was improved short-term and long-term knowledge. At level 3, there were individual interviews with CHWs 1 year later after the training to see if their behavior had changed. And the evaluation showed that there was application of the health-related behaviors that had been taught towards themselves and others. They felt more confident and willing to share the information that they had learned in the program, and enable them to provide advice and conduct referrals to community members. So the 1 year later, the CHWs were being asked about how they were using what they had learned in the training. And then finally, at level 4, 1 year after the training, the evaluators did community focus groups. And so they're asking about what the CHWs are doing in their community and about their behaviors. And the evaluation findings found that there was community empowerment, enhanced community knowledge, and health-related behavior. So this is just an example. And so what you want to think about is for each level, what is the type of evaluation you're going to do? Is it going to be a survey? Is it going to be an interview? Are you going to, if you have $1 million program, are you going to go into medical records and see if there's actual changes? So yeah, anyone have an example to share for a training evaluation? Even if you didn't use the term Kirkpatrick, what were some of the things that you were evaluating? I'm gonna see who's on here. See if I can call out anyone. Oh, my keyboard's not working. Denise, can you speak? I know you might not be in a place that you can speak. She was at that meeting that I was telling you all about. Okay, she's not. All right, well, thanks for being here anyway. I know there's some CHW eyes on here, and so this becomes.
Hi, this is Denise. I couldn't figure out how to unmute myself.
Oh, sorry. I was talking about Denise Hernandez, but Denise Griffin.
No, go ahead.
But no, have you been involved in evaluating trainings?
Well, yeah. I mean, as an instructor, I have, and basically it's compliance, right? I mean, are they complying with, the rules that we set for their competency?
Mm-hmm.
So that's what I was going to say.
Yeah, thank you. That's a good point. You want to assess not just knowledge, but if a training is competency based, are they going to be competent to practice the skills and the abilities that are being taught? So thank you for bringing that up.
Correct. Thank you.
All right. Okay, finally, impact evaluation. It assesses changes attributed to the project, and these are really important for informing evidence-based policymaking. And so you have your intervention at the top. Switch my mouse over here. And then you have your outcomes of interest. So you want to know if I deliver a maternal health club, are the women going to attend their postpartum visits? Are they going to feel supported and be able to identify signs of postpartum depression? Are they going to sign their newborn up for routine newborn care? So we want to know, like, what are we trying to change? What are those outcomes from the intervention? And then we want to measure the impact. So were those outcomes achieved? Was there some achievement, or there was no achievement? Or the program hurt the population? So if the outcomes were achieved, then that's good evidence to scale the program and provide additional resources. If there was some achievement, that's when you want to go back to your process evaluation. You want to investigate what worked, what didn't, what could you change to improve your outcomes. And then if your outcomes were not achieved or the population was harmed, you want to stop the program, you want to defund it. This happens. I won't go on with examples, but there's big programs that the US government had funded for years. And then when they did an impact evaluation, they found out there wasn't any improvement. And so then the government stopped funding those programs. And so the goal is that you find out if programs have an impact before scaling across the US. That's why pilots are so important. Okay, so here's an example. It's an observational study. So an observational study is a mix of research and evaluation. It's research because of the methods that the data is collected, but it's not an experiment. They're just observing a program that is already ongoing to determine the outcomes. And so in San Antonio, there were patients that were paired with CHWs to focus on diabetes self-care. And so there were a cohort of patients, a group of patients who were enrolled in this intervention. It's not an experiment because the intervention was going to happen anyway. It's also not an experiment because, well, I won't go into that. So the hospital was deciding to do this anyway, and then the data was going to be collected and the outcomes were assessed. So the intervention was CHWs engage the patients in trust building and building understanding of the patient's context, their health goals, and how to navigate different healthcare and community resources. The investigators were looking at the progress of the patients through 3 stages of diabetic self-care. And then as secondary outcomes, they were measuring their changes in hemoglobin, so A1Cs, and the need for urgent care, emergency departments, or hospital visits. The impact was that, so in the 3 stages, 27% only were in that first stage. They only, the CHWs were only able to do outreach with them. 41% progressed to stabilization of their diabetes care, and then 33% achieved self-care, the highest level of self-care for managing their diabetes. And then the secondary outcomes, there was almost a 9% or up to a 9% decline in the hemoglobin levels, depending on the self-care stage. And they did see that the patients who are working with CHWs, they went to the emergency department less and they had fewer hospital visits. So if you were the insurance company or government payer, would you choose to pay for this program? Anyone work in diabetes care and know if a 9% decline in A1Cs is significant? I'm seeing a lot of yeses. Yes. Yeah, so what I've been told by CHWs who work in diabetes care is that this 9% decline in A1Cs is pretty impressive. And so this is a program that could pay off. It could, and if you're reducing the need to go to the emergency department and need to go to the hospital, you're improving quality of life and you're saving healthcare costs. A lot of policy decision makers, they care about the return on investment and cost effectiveness. And so when you're evaluating an intervention, especially one involving CHWs, it's important to look at how healthcare utilization changes. As a CHW, you are likely interested in how their quality of life is changing and the health outcome is changing. But a lot of policymakers care about the healthcare utilization because that's affecting dollars. So this is an example. Anyone want to share if they've been involved in an impact evaluation, or if you've seen a story recently about a CHW-led program that was effective? Okay, if not, this was my example. So, and it's in the news. It was, if anyone in San Antonio knows Dr. Carolina Schlinker, she's a huge proponent of CHWs, has a great team of promotores, and it's really great when we have these evaluations that border research to show the effectiveness of CHWs in care. Thanks, Alexandra. Currently working on a non-adherence pharmacy pickups among patients with low-income Medicaid patients. Thanks. All right, we are getting towards the end. So I want to leave you with some practical steps for planning and evaluation. So first, you need to think about how you'll collect your data. What kind of methods and tools will you use? So surveys, questionnaires. Will you do statistical analysis of data that already exists? The state and your county collects a lot of data already, and some of that can be publicly accessible if you request it. So you could analyze the health outcomes that are already reported. Do focus groups or in-depth interviews, or you can do observational studies. So you're collecting your observations, like I just went over in the last study of what's happening. And then you need to think about what time points. So it's really good and important to have data collected before, so that when you measure your data at the end, you have something to compare it to and know if there was a change. If an intervention is really long, or there's an intervention that has multiple steps, it's helpful to also collect data in the middle. So for example, if you're doing a healthy postpartum intervention, you would want to collect data maybe during the second trimester, at delivery, and then at the end of that fourth trimester, so 12 weeks, and see how things change from before, middle, and end. So this is an example of a survey and questionnaire. So this is a health promotion knowledge survey, and it's asking about someone's knowledge of these self-care areas. So oral care, diabetes. And so for knowledge surveys, it is common to do pre-post to evaluate change in knowledge. Here's another example. This is focus on ability. So someone's being asked, not just do they know something, but can they do something? This is actually pretty similar. Some of these questions you might see in the surveys that you all take after these, because we're asking about things, if your behavior will change. Okay, here's another one. So this is focused on confidence. So if you've heard the term Likert statement, it's usually like on a scale of 1 to 4, on a scale of 1 to 5, I feel confident in this. I feel comfortable in this. So it's really important to measure how confident someone feels in performing something that they've just been taught. And then finally, here's level 1, satisfaction. So I agree, I disagree, I strongly agree, strongly disagree. These are questions about, if the training was relevant, if the facilitator was useful. And then focus group discussion and in-depth interview guides. So when you guys get the slides, you'll have this link, but the YMCA in, I think it's like Wisconsin or Michigan, they have all these evaluation tools online that you could adjust for your program. And so for focus group discussions and interviews, you want to go in with a clear plan. You want to know, like, what are the questions that you're going to ask to elicit information that will be useful to understand in your program. But there's some key parts that every focus group and interview should have. There should be a consent process at the beginning, and a process explaining how confidentiality will be kept. The moderator and the note taker should be introduced, and it should be explained, like, what's going to happen with those notes afterwards, or the recording afterwards. And you have to make every effort to keep the notes and the recording private and confidential, so that people feel comfortable being honest, and that there won't be any repercussions if that information was shared with maybe their boss or a spouse or partner. And then for the questions, you have like your main questions about what you want to learn, but then for each of your questions, you want to come up with some probes. You want to avoid yes/no questions. You really want to get people to open up, and so you can learn about their reaction to the program, what they felt worked, what didn't work, etc. And then also it is normal to receive incentives to participate, like a gift card of some amount. You need to think about what is amount that makes the person's time worthwhile, but isn't so big that it will influence the results, that they're going to lie because they want to make you feel happy about your program. Okay. I think people, Alexander, I like your $10 to $50. I usually do like 20 to 25 per hour. So yeah, I think that's very appropriate. Another another point I want to make is how important demographic questions are. And so this includes things like asking about gender, sexual orientation, gender identity, race, ethnicity, age, veteran status, disability status, education, income. These questions are really important to know. The responses are important because we want to know a couple things that are important. One, is your program reaching people who usually fall into a minority category that is at a disadvantage for health? And then two, how health outcomes are different by the different demographic categories. So a couple examples. We know there is a horrible maternal health crisis in the US where Black women are dying 3.5 times the rate of white women. When we're collecting data on maternal death, if we didn't ask about race, we wouldn't know that. So we have to know the demographic data to better inform programs to make sure that the most at-risk populations are being met. The CDC, I like going to the CDC website and using their language. I would say sometimes it's like a year or two behind on like what is like the appropriate way to ask a question. For example, for the ethnicity or the race question, there's a movement to break out or to add Middle Eastern, Northern Africa. And I like, depending on what example you go to, Middle Eastern / North African might not be in the list of races that is asked about, but it is a good practice to include that. And so if you want to make sure that you're using the most appropriate language in your survey, I would look for current examples online to make sure that you're using appropriate language. Okay, so this is just putting it all together. So say you had a program that you are designing. So this is a log frame. It's kind of similar to a logic model, but it's something different. It kind of combines everything. So on the left-hand side, you can see goal, outcomes, outputs, and activities. And then across the top, you have your project summary, your indicators, like what are your measures, like number of people, A1C level, your means of verification, so how you're going to measure those indicators, and then your risk and assumptions. And so across your goal, your outcomes, your outputs, and your activities, you're going to describe what you will do. You'll describe what you'll measure to evaluate what you do. You'll then describe how you'll measure what you're doing. And then in risk and assumptions, you're thinking about like, what makes my program possible? And if there's challenges, what am I not going to be able to do? So here's an example. It's on a program to try. The goal is to reduce serious injuries and deaths among children in grades 1 through 5 involved in motor vehicle collisions. The outcome I want is a 10% increase in the use of seatbelts among children in grades 1 through 5 in Laredo, so very specific. My outputs are that 200 children from Laredo Elementary, grades 1 through 5, will complete a car safety day camp. And my activities will be that there will be 5 day camps, each with 40 children in grades 1 through 5. So whereas in a logic model, we went from inputs to activities to outputs to outcomes to impact, you can see this similarly, but we're going from bottom to up now. We have activities, outputs, outcome, goal. So for my indicators, I'm measuring at activities, number of day camps, at outputs, number of students participating, outcome, % of students reporting seatbelt use, and at my goal is to the percent of collisions resulting in death or hospitalization. That's going to measure if I was able to reduce. And then you can see my means of verification. This is how those methods that I'm collecting the data. I'm going to look at day camp records to see if the camps happened. I'm going to look at the attendance sheet to see how many kids attended. I'm going to measure I'm going to give the parents or the students a survey at 3 months and 6 months after the day camps to ask about their seatbelt use. And then for verification, I could actually go into accident reports or hospitalization records. Now, if this is a small program, you don't have the funding to go look into accident reports or hospitalization records. Maybe you go to the school and you ask the school to report on the number of unfortunately student deaths or injuries for medical or extended absences for medical reasons, and you use this as a proxy to know if you've met your goal. Okay, but for it to be successful, I have some assumptions. Or if it's not success, or maybe there's some risk where I might expect that my program won't be successful. So, if I have 5 Saturday day camps and parents are willing to send them to the camp, then I'll have 200 students complete it. If I have 200 kids go to my day camp and they apply I'll put my mouse over here, and they apply what they learned, then we'll see an increase in seatbelt use. And then if we have an increase in seatbelt use, and that reduces seatbelt injuries, then I expect to see a reduction in fatalities and injuries. So it's another take on the logic model, but it combines everything about your program into one grid. So like how you're doing your data collection, and also like your measurable goals. Okay. All right, so then finally, you've done your evaluation. Now you need to disseminate it. So when planning your evaluation, you need to plan out how and to who you'll disseminate the results to achieve your project and evaluation goals. And so this is the same list from the beginning when I addressed, why is it important to do evaluation. So you need to think of the stakeholders who have a different interest in why you're doing the evaluation. And then think about the format that you want to deliver the results in. So I'm going to ask for some participation. If you want to present the results to a neighborhood association compared to City Hall or compared to hospital leadership, how might that dissemination look different?
Hi, this is Julie Wright from Texas Health in Arlington.
Yeah.
For us, that would be for the neighborhood organization like an HOA or a community group. I would really focus more on the impacts and the improvements to quality of life for social determinants and health outcomes. For policymakers or like a city council or someone like that, it would be more on the return on investment, the cost benefit side of it.
Yeah, thanks. So it goes kind of back to that diabetes study. What does that stakeholder care about? The health outcome, the cost of the program. Thank you. And then Denise in the chat box put have an informal gathering. So the forum might also look different. With the neighborhood association, it might be over a meeting at night that's very informal. There could be kids running around. Whereas with hospital leadership, it could be in a boardroom. With the city government, it might be at commissioner's court to to advocate for the program. It's gonna be a whole lot, it's gonna look a whole lot different than either of the other two examples. So just it's really important that you know, thinking back to CBPR, community-based participatory research, you want to make sure that your results get disseminated to the community and to funders and policy implementers and people who are going to be able to support your program. All right, final stretch. This is the fun part. I hope you guys are ready to participate more. So role of CHWs in evaluation. It's important that CHWs are involved in all phases of the evaluation and research, like we talked about in the beginning. Does anyone have an example of how they've been involved in evaluation beyond the examples that have already been shared? Let's see, who do we have on? Okay, I see. So I know there's some CHWs on that are going through our public health fellowship, including Avilia.
I would like to say I'm involved with FEMUR. It's a fetal infant mortality review board. So we review current, like, deaths of babies and see what went wrong during the preconception phase or during the while they were, in.
Yeah, no, great example. Thank you. Jessica, let's see, make sure okay, Yanis. Can you tell me what the evaluation you're planning to do with the mobile health fairs?
Diane, I am so embarrassed. My anxiety actually was triggered today, and I really can. I'm sorry. Of all days too. I love talking.
No,
I'm so sorry, guys. I'm sorry.
if it's not a good time, that is fine. This is the problem with calling on people. At 0 for 2.
I'm so sorry, guys. Yes, I do have anxiety and I'm already panicking, so I better stop.
Okay. Oh, I see
Sorry,
Ludi on. Ludi, have you done training evaluations? All right. If Ludi doesn't come off mute, then I'm just gonna stop.
That's too funny. Poor Cheyenne. They left you here all alone today.
Oh,
And no one's like-
Lisette!
Okay, I'll be quiet.
Yeah, okay. Lisette, please go ahead.
Hold on, because I'm in my phone and I'm in the school, so I'm trying to get out of here so you can hear me. So we did something that's called the social network analysis, and it was an evaluation that we had to survey our residents that we've been talking to, and kind of see where the connections that we have made in the community, like how open they feel us, and how they connect with us, how they trust us about their health. So it was very interesting because we have never done that. And it was really nice to see how people is being connected to each other in the community. That's what we're doing. We're doing our program. The importance in our program is that they have someone that they can rely on to help them with their health. So it was really good to do the study. And we were all part of it, and how to even ask the questions, because like you say, it's not only important to tell them that there is private and there is all the good, is the questions that they understand. Because it was a group that was helping us with the questions, and some of the questions were like, no, people is not going to understand what you're asking them in here. So we all put it in a level and in a way that we can ask them and we can get the input that the people can give that input, so we know where we are. So it was really good.
I love that. So I heard you say you use a specific framework to evaluate social connectedness. And I heard you explain your role in eliciting the information. So you're probably breaking down certain questions into language that resonates with the community and making them feel comfortable to participate. So I love how you just demonstrated your value.
Yeah, exactly. That's how it went. And it went really good because then they did the study and they put it all in a map, how we connect to people and how people is connected to others. And now we know what we're missing. Now we know how we can make those communities be more close and connect to each other. So it's kind of very cool.
Yeah, no, I love that. So then you just demonstrated the impact you had and the potential for doing more. And so if you have more resources and can do it again in a different community or and expand it to more people in the community, the impact that you can have. So great demonstration. Thanks, Lisette. So yeah, so some of the things which Lisette just demonstrated, CHWs can help identify the evaluation design. So help design the community forum or like the focus group and how it's going to be run to make the community feel comfortable. If it's a community that is going to be better with oral communication over written communication, the CHW can speak up and say, I think we should do focus group discussions and not surveys. Identifying, okay, so that's the identifying the data collection methods. The specific questions, so rewriting questions to be understood clearly by the community, helping collect the data, so being that focus group facilitator. Going door to door to deliver questionnaires. You know, CHWs are a friendly face, they're trusted in their community, and so they'll really, or you all will really improve data collection for the evaluations. And then you can be involved, you should be involved in analyzing and interpreting data. So participants are using, you know, like colloquial or slang terminology or yeah, like they're using language or like cultural terms where the CHW knows what the participant is talking about and the researcher doesn't, then you have an important role in accurately telling the participant's story and making sure that their reality is in the data and not misinterpreted. And then sharing and applying the findings. So making sure that the community's stories are told accurately and told to people who are change makers, whether those change makers sit in City Hall or in a neighborhood, that people who can create change for better have those findings and can put them to use. Yes, Aranda, thank you for reiterating that. All right, so just to bring it home, the advantages of CHW involvement, you bring your community knowledge and lived experience to evaluation. It's also important to speak up and make sure that your role is being impacted. Unfortunately, the community health workforce is still under scrutiny for proving yourselves. So you want to try to look at make sure the evaluation is assessing your impact. So if you weren't a part of that team, what would have happened differently? Or because you were there, what happened? And like I said, improving community's participation, ensuring the community voice is in the center of the data. And keeping the project team accountable to the community needs. If the program starts to break down or veer in a different direction, or gets forgotten about, you want to make sure that you're bringing the project team back to focusing on the community.
Thank you for that, Cheyenne. I was wondering about that the other day. I was like, what happens if this isn't what, the project for me or something? And I was wondering about that. So thank you for that answer.
Yeah, and like, sometimes maybe a donor wants a very specific outcome. And so your primary outcome is reduction in hospitalization. But you can look at secondary outcomes about like nutrition levels, self-care. So you can meet your donor's request, but then also evaluate what the community wants to see a change in. Yeah.
Thank you.
All right, so we're wrapping up. I'm evaluating your intended behavior. So, does anyone have ideas for how you could actually get involved in an evaluation of a current program you're a part of? Or maybe you're part of a program that doesn't have, okay, show of hands. Is anyone working on a program that there's no evaluation strategy, or there's no evaluation strategy that you know of?
I think we're kind of there right now. We're like, because we had put down like pláticas and stuff like that, and I'm all new to that. And but then when we talked about it the other day, no one mentioned anything, and I was like, okay, you guys, so I was like, I was all freaking out because I want to do them. I mean, I want to know about the community, Um, thank
Yeah, no, I think pláticas are, we talk a lot about them in Texas. The sharing, community forum, and lessons are shared, and that's totally an evaluation strategy. So you want to capture those lessons and make sure they inform a future project.
Awesome.
Yeah. Thanks for participating, Jessica. You're always a great participant.
Thank you. I'm so excited about all this. It's so exciting. I'm just like, oh, okay. So you see me, I'm always
I
spazzing
love the
around.
excitement. People are like, "Oh, evaluation is boring,and I get really
Oh my
excited about
God.
evaluation because
I'm like ready to run out the door right now and just go meet people and just you get me
yeah, I mean,
inspired. You inspire me as well.
yeah, I
You
wish I
do.
could. I mean, like
No,
I
you
said, like
do. Thank you.
you can't improve what you don't measure. Um,
Yeah.
so if it's
So, yeah.
designing a questionnaire, delivering the questionnaire, looking at the data might be boring, but unless you have that data and can put it together in a way that um, provides answers
Mhm.
to, like I said, change makers, you're not going to be
Yeah.
able to extend your program, or improve the value of your program, or find out what you're doing wrong. It is okay if you find out that you're having no effect and doing something
Yeah.
wrong, because that's going to save you future dollars.
Human stories. That's what they want to see, right? Want to get some tears going. So let's talk to Bo later. Me, you, and Bo, and all the girls. Other
Yeah.
girls. Okay. Okay. Awesome. Okay. Bye. I'll
Right.
keep listening.
I'm seeing people in the chat with some examples. So thank you for that. As we're wrapping up, yeah, just take some time, read the examples in the chat, share your own. I'm glad that I'm not the only one that gets excited over data. Oh, thanks, Sheena. I like that example. All right. So in the slide deck, you'll get some resources for further reading. So what's really cool about evaluation is there's a lot of tools that are publicly available. Maybe you find an evaluation for a nutrition program and then you change it for a sex education program. But the tools will kind of again, go back to like, what time of your program are you evaluating and what do you want to get out of it? And that will help you decide your framework. And then do a logic model, because it helps you see, what am I putting into it and what do I want to get out of the program? And then that the log frame, it maps it all together. It maps it to your goals, your risk, your assumptions. So go check out these resources. And then what you've all been waiting for, your CEU survey. So take the survey. I will attempt. All right, I gotta stop sharing my screen for a second because I need to grab the link. Put that in the chat box for people. But go ahead, tell me what are your questions in the meantime while I get that link.
Are you going to share the slide?
Yeah, I will share the slides. Probably tomorrow.
Thanks.
Yes, Javon, is tomorrow okay, or do you want it today?
Tomorrow is fine, don't worry.
Thank
It's
you.
just as far as you get, if we can call you, if we don't understand something, to do it.
Yeah, no, I will, I'll get it out tomorrow. Like I said, I'm in Austin today at a very exciting meeting about getting CHWs paid through Medicaid for taking care of high-risk women. All right, let me get my slides back up. All right, so the CEU survey is in the chat box, and this is the matching QR code. Yeah, questions. I'll stop recording, and then maybe people will feel a bit more comfortable.